Hi, my name is Dr. David Scratchling. I'm a psychologist working in Seattle, Washington. I specialize in the study of addiction. I work with both adults and adolescents who are struggling to overcome or to learn to live and successfully treat the condition of addiction. Today, I'd like to start by talking with you about marijuana and some of the compounds related to marijuana that people are using today, specifically the designer, if you will, drug that we call spice, and marijuana that is dipped in formaldehyde, which we call wet or sherm. You can download the information you're about to see at my website, which is www.drugseminars.net. At that website, you'll find these brochures or these pamphlets as study guide, and you'll also find hopefully other information that you find useful. Now, when we start to talk about marijuana, I think it's important we realize that the marijuana today is considerably different than the marijuana that, say, for example, was available when I was in high school. Marijuana, when I was a younger person, was about 0.5% to 4% THC. Now, THC is the abbreviation for the active ingredient in marijuana that is actually known as tetrahydrocannabinol. Now, today's marijuana is actually so much more powerful. It's 18 to 20% on average THC content, that we discover that people don't use large quantities of this when they smoke the drug. They often will smoke blunt, which is a cigar hollowed out, and that is sufficient to provide the person with a complete high from marijuana. Now, when we start to talk about marijuana addiction, it's very clear that many people are confused as to whether or not the drug is addicting. And what I would like to tell you is that approximately 10% of the people who use marijuana will become addicted over the course of a lifetime, and that the marijuana addiction is actually one of the toughest addictions to treat. It's especially devastating when the individual is an adolescent, as it causes such a disruption in normal learning. Now, as we start to look at marijuana's actual effects, what we discover is that marijuana is a long-lasting drug. The active ingredient in marijuana, THC, is something that even if you were to smoke the drug once, would be in your body, at least detectably so in the average person, for about 250 hours. Now, during this time that the drug is in your body, it has a number of different effects. It will increase distractibility, decrease attention span, impair your short-term memory. If you've been around people who smoke a lot of marijuana, you'll discover that they aren't very good at remembering things, and that is due to the action of THC. It alters the perception of time. A lot of people who smoke marijuana actually feel as if time has frozen or has stopped, and it's very difficult for the individual to sometimes be able to determine, has the day passed? They're very surprised at the end of the day. Often when the day ends, the bell rings, because they really don't notice the passage of time. Marijuana creates a false perception of richness of thought. If you've been with people who smoke a lot of pot or marijuana, you'll discover they often have ideas that you find pretty ridiculous if you were to talk with them, but they're fascinated and can spend years actually thinking about these ideas. The drug reduces anxiety. When people are smoking marijuana, they ought to be alert and anxious over the fact that life appears to be going nowhere. But instead what happens is the drug reduces the anxiety, and as a result the person languishes or it struggles with being in a state where they aren't moving forward, but they aren't particularly anxious either. So it impacts motivation. People who have smoked a lot of marijuana and have recovered will tell you they probably didn't do all they wanted to do in their life while smoking it. Now, as we look ahead with marijuana, what we discover is that marijuana has a number of different effects. It causes euphoria and relaxation, but some people will actually feel panic when they take it. When we have the drug in our system, we become intoxicated with it. What we discover is that it distorts perceptions and times, and it also intensifies our normal sensory experience. Now, for people who smoke a lot of marijuana, you might discover that a person actually becomes much more anxious over time, can become depressed over time. And sometimes when this occurs, a person may actually be thought to have a depressive disorder or an anxiety disorder, and even in some cases a psychotic disorder, when in fact what's happening is they're toxic or they have smoked marijuana for a long, long time. Now, when people actually smoke the drug, their heart rate goes up and they often lose blood pressure, interestingly. But over the long term, what happens is that this particular drug can cause cancer, it decreases testosterone, and it has a host of different problems that are difficult for the lung. Now, there are some ways in which people modify marijuana. One of the ways that is most dangerous is to create something we call wet or sherm. This is where we take what people call embalming fluid, but is actually formaldehyde, and in doing so, we dip the marijuana cigarette into the formaldehyde, and the result is that the person gets a feeling of almost being drunk when they smoke it, in conjunction with the action of the marijuana, but it causes severe behavioral disturbance. The person may report that they're stuck and unable to move. They can become extremely psychotic, and marijuana itself, over the long term, is thought to damage the nervous system or cause what we call lesions or scars, but formaldehyde definitely causes scars or lesioning in the brain. So when people do this, what happens is they cut down on oxygen in the brain, and the person may actually, in terms of using this drug, become quite psychotic over time. And so when people are thought to be using marijuana in conjunction with formaldehyde, it really is something that needs immediate care, especially if that person happens to be an adolescent. So let's take a look at another way people modify this drug. Now, a very interesting and recent trend starting in the mid-2004-2005 era was the drug K2 or Spice, a designer marijuana compound that hit the market. Now, people found this very, very popular because, to begin with, it wasn't illegal at the federal level, although several states now have made Spice or incense or K2, all names for the same synthetic type of THC, the active ingredient in marijuana. People have found this very attractive because of the legal issue. Some states it is legal, other states it's not. Federal law is moving to make this a federally illegal compound. But the other issue is that it is much more powerful than regular THC, so the high is much more potent, and people using this drug are more likely to become very agitated and psychotic. We don't know a lot about it. We don't know if it's safe. We don't know what happens when people abuse this drug and start to withdraw from the drug. We really know very little about it. So I'd have to tell you, I think this is a very dangerous type of addition to the arena of marijuana use. Now, as we look forward with this, what we see then is that this particular compound, marijuana, is in fact a very powerful drug. When we start to talk about it, I know there's a lot of concern and a lot of people debating the medical use of the drug, the legalization of marijuana. I'm not as concerned about either of those issues. I am much more concerned about the perception of marijuana as being a safe drug. I actually don't believe it's a safe drug from the standpoint it can trigger addiction and it has a host of psychological issues. So despite the fact people are moving towards legality, legalizing the drug, or looking at medical use, I think we need to balance our efforts on medical use against the fact that some people will become addicted, and also the perception that this creates in younger people that somehow this particular drug is a safe drug. So I want to close by again inviting you to go ahead and visit my website, drugseminars.net, where you will be able to see a host of different videos as well as download this information. I appreciate you listening today, and feel free to contact me at seattleclinical@gmail.com if I can be of assistance. Thank you.